Hi, my name's Nav and I'm an orthopaedic surgical trainee and a clinical research fellow in Edinburgh. And I'd like to discuss the surgical treatments for Paget's disease of bone. So I'll just share my screen. So a quick outline of my talk. I'll briefly discuss the background of Paget's disease of bone, although I know that's been comprehensively covered by the other talks available today. I'll then go on to discuss the common forms of surgery that may be available to patients with Paget's disease of bone. I'll discuss the most common ones, which are total hip replacement, total knee replacement, osteotomy, which is essentially a controlled break in bone, how we fix broken bones, and I'll go on to discuss the outcomes of surgery that patients with Paget's disease of bone can expect and how they compare with unaffected patients and what is available in the literature about that currently. A brief discussion of the background of Paget's disease of bone. Bone is a very biologically active tissue and it is continuously being made and remade. It's not just made and then stays made. And this is in response to both mechanical forces of weight bearing, but also in response to these mineral stores that your body has or needs, such as calcium and phosphate. And this balance is carefully regulated by two main types of cell, the osteoclast, which breaks bone down, and the osteoblast, which builds bone back up. And in Paget's disease of bone, this balance is somewhat dysregulated or abnormal. And there are many more of these bone breaking down cells, osteoclasts, and they are working much more actively than is normal. And as a result, bone is being broken down at a much more rapid pace, and the osteoblasts, which build bone back up, can't keep up in a regular fashion. So they build bone back up in a very disorganized manner. And as a result, this produces the features that we see in Paget's disease of bone, which include thickened bone, but also abnormally shaped bone, and also bone that's mechanically weaker than normal and can break more easily than in areas that are unaffected by Paget's disease of bone. The UK has the highest prevalence of Paget's disease in the world, and that's why it's of particular interest to us here in the UK. It's a disease of aging, and in fact, patients under the age of 55 are rarely affected by Paget's disease of bone, but over the age of 55, there's an overall prevalence of about 1 to 2 in 100 people. And in fact, the prevalence doubles each decade after the age of 50, so it becomes more common as people get older. Just because you have Paget's disease of bone doesn't mean that you're ever going to have any symptoms from it, and it can well be asymptomatic for your entire life. And some patients that do have Paget's disease of bone never ever notice any symptoms. However, commonly patients can report bone pain. They can also report bendy bones or deformed bones. They suffer from wear and tear more frequently than patients unaffected by Paget's disease of bone. And that's what we call arthritis of the joints. And they can be more prone to breaking their bones because the areas that are affected can be mechanically weaker than normal. And the most common areas that are affected are the skull, the pelvis, the thigh bone, the long bone of the thigh known as the femur, and the spine, and more specifically the lumbar spine. So what are the most common forms of surgery for patients with Paget's disease of bone? Well, overall, around 8% of patients that have Paget's disease of bone will require some sort of orthopedic intervention or surgery, and that's data from the PRISM study, which was recently published under Professor Ralston's group. And the most common type of operation that patients with Paget's disease are likely to require is joint replacement, and this is predominantly total hip replacement and total knee replacement. And that's to treat wear and tear, changes of the joints, but also can be used to treat deformity of those bones close to the joint. And we know that from the recent data that patients with Paget's disease of bone are 3 times more likely to require a total hip replacement and almost 2 times more likely to require a total knee replacement than patients that are unaffected by Paget's. Other operations are less common, but they can include osteotomies, which are controlled breaks in bone. And we tend to perform this when we want to straighten a bone that's abnormally bent, as can be the case in Paget's disease of bone, but also when we want to fix broken bones. So these are things like plates and screws that we use to fix broken bones, but more commonly and more recently, we tend to use pins that go down the middle of a broken bone to keep them straight, and also that allows us to put weight on those areas more earlier and more frequently. So the most common operation performed for Paget's, as I mentioned earlier, is joint replacement, and the most common type of joint replacement is total hip replacement. And that's true not only for patients with Paget's disease, but also for all patients. The reason why this is more common in patients with Paget's disease of bone is likely to be because the most common areas that are affected by Paget's disease are the pelvis and the femur, and this is where the hip joint is, which is the ball and socket joint at that area. And the socket of that ball and socket joint is called the acetabulum, and that's located in the pelvis. And the ball of the ball and socket joint is located at the top of the thigh bone, known as the femur, and we call that the head of the femur. So these are the most common areas affected by Paget's disease, but they're also the areas where we perform the most common operation, which is a total hip replacement. And it's likely that when these areas are affected by Paget's disease of bone, they cause or exacerbate arthritic changes or wear and tear changes at that joint, because they result in structurally abnormal or weakened bone or abnormally shaped bone, which tends to alter the mechanical forces going through the hip joint and makes them more prone to wear and tear. So how do we perform a hip replacement? Well, these are two pictures that patients don't normally get to see, and this is how you would normally be placed for a hip replacement. You're normally placed on your side, lying down, and secured very securely by a various number of clamps in certain areas. And this is the theatre setup that you can see on the right here. And these are special suits that the surgeons and the scrub nurses wear to make sure that they minimize any risk of infection. And all of these are completely sterile to, again, minimize any risk of infection that could occur in that area. So they're very clean, very sterile rooms where we perform this operation. And this is the patient all prepped up for their hip replacement. So you can see that there are specialized drapes and specialized dressings that we use to make sure that the area, again, is as clean as possible. So this is a hip replacement in a nutshell. Essentially, we perform a small incision at the side of the hip, which is longitudinal in nature, and then we get down to the hip joint itself, and here you can see the head of the femur, or the ball and socket joint, and we use an electric saw to saw away that ball, which is affected by wear and tear changes and arthritis, and we take away that ball of the ball and socket joint, and that enables us to see the socket, which is the acetabulum, which, as we know, belongs to the pelvis. And again, this is affected by wear and tear changes and arthritic disease. So we want to remove all of that, and we do this with a specialized drill called a reamer, which takes away a lot of that worn away tissue and exposes more healthy bone. And into that we can insert a special cup called an acetabular cup, which tends to be metal in nature or plastic, depending on whether on the implant that's used by the surgeon. Once we've done that and it's secured into place, normally with cement, which is essentially like a grout, which keeps things extremely secure, we can then turn to the ball of the ball and socket joint. And in order to do this, we essentially look at the long bone of the thigh, the femur, and this has a canal already inside it as a natural phenomenon. We increase the diameter of this canal so that we can insert a stem down the middle of the thigh bone, again normally with cement, and we put on top of that, the ball or the femoral head, which is again an artificial device, which traditionally is metal or titanium. And then we have our finished hip replacement, and that's what it normally looks like. So how do we perform a knee replacement? Well, it's very similar in nature, in that what we want to do is we want to take away all the diseased portions of bone which are affected by arthritis, and we do this with a saw. We take away the top of the or the bottom of the thigh bone, the top of the knee, and also the top of the shin bone, which is the bottom of the knee, with controlled cuts with an electric saw. And then we replace these with shiny new metal implants and a plastic liner in between, which assists with movement and also shock absorption. And that's really the finished result. You end up with a small scar down the middle of your knee following the operation. And on the left here, you can see an X-ray of what this would look like. So this is a patient who's affected by Paget disease of bone. You can see that here predominantly at the shin bone, which has caused a lot of wear and tear arthritis at the knee joint itself. And following their knee replacement, their knee's now nice and straight. And these are the metal implants that you can see front on and also from a side view or profile view. And that's what it looks like when you have a look at the X-ray of someone with a knee replacement. So in the vast majority of cases in patients with Paget disease of bone, although the operation can be technically slightly more difficult, it doesn't require anything special compared with patients who are undergoing a knee replacement who don't have Paget disease of bone and just have arthritis. However, sometimes with Paget disease of bone, there are added complications which make the surgery more complex, really. And most of these are related to the fact that there can be deformity at these bones, or these bones can be abnormally shaped. That needs to be addressed at the same time as the knee replacement or the hip replacement itself. And these are two pictures of where that's required. So on the left here, you can see that this knee is affected by arthritis, wear and tear changes, which means that there's hardly any gap on the outside of the knee joint here. And there's a lot of white here, which shows that there's a lot of arthritis. But there's also this bend in the bone, and we couldn't really insert a normal knee replacement into this without there being a high risk of that failing. So we have to address the bend in the bone as well. So we've done this with an osteotomy, which I'll come to, but as you may remember, it's a controlled cut or a controlled break in the bone that enables us to straighten up the bone. So we do that with a saw. We make a cut in the bone here. That enables us to straighten up the bone by taking out a specific wedge. And we can then put plate and screws there to keep it nice and secure in that new straightened position, and insert our knee replacement, which in this case is a special type of knee replacement which has an added stem for added security. And that treats two things in one: the deformity or the bend, but also the arthritis with a nice new knee. And on the right here, it's a similar case, but instead of having this special type of knee replacement, we've been able to use a normal knee replacement, but use a thickened plate, which is likely to be much longer as well, which gives the security that's required. So there isn't an added need for a stemmed knee replacement. So that brings me neatly on to osteotomies. So these are controlled breaks in bone where we take out a specific wedge of bone, and that enables us to have what was originally a bent bone straightened into place by taking out that wedge. And after we've taken that out, we secure the break that we've made with a plate and screws so that we can keep that in place nicely so it heals in a straight position. And this can be used to treat deformity or abnormally shaped bone, but it can also be used where there is to redistribute mechanical forces across a joint where there's wear and tear changes. So, for example, sometimes there's wear and tear only on the inside of a knee joint because there's much more force going down the inside of the knee. And if we wanted to, we could create an osteotomy known as a high tibial osteotomy to redistribute those forces to go more towards the center or even the outside of the knee, so that we can relieve the stress that's been put on the inside of the knee where the wear and tear is, and that can be used to relieve pain and potentially to reduce the future need of a knee replacement in someone who has arthritis just on one side of the knee. So we've already discussed that in patients with Paget's disease of bone, in the areas that are affected by Paget's disease, the bone can be mechanically more weak than normal and therefore can be more likely to break. In this case, we tend to fix these broken bones in much the traditional way as with any bone that's broken that requires an operation. And this is most commonly with a pin. So this is what we call an intramedullary nail, which goes down the center of the central canal of those bones, which are already in place in these long bones, such as the thigh and the leg. And in fact, the most common areas that are affected by Paget's disease of bone are the thigh and the shin, where breaks occur, and that's because we tend to put, these are the bones that we put weight through when we're walking, and therefore they're more likely to be susceptible to stress and therefore more likely to break. These operations can be more technically difficult in patients with Paget's disease, just because the bone can be thickened and it can be, they can be bent or abnormally shaped. However, the outcomes that we have in fracture fixation in patients with Paget's disease is essentially equivalent to those in patients without Paget's disease. So there really isn't any difference in terms of healing in most places. However, there is some evidence to say that when you break the bone at the top of your thigh, these areas don't do as well, so they tend to heal more poorly than in other areas. So what is the evidence that we have about outcomes that patients with Paget's disease can expect to achieve compared with patients that aren't affected by Paget's disease? Well, in terms of total hip and knee replacements, it's important to recognize that these operations, total hip replacements and total knee replacements, are some of the most successful operations that are performed in surgery as a whole. And satisfaction is extremely high in these patients, and the quality of life improvement has been shown to be extremely high in all patients. The evidence that we have when we compare patients with Paget's disease of bone with those without Paget's disease is that satisfaction, or patient satisfaction, is essentially exactly the same. So you can expect to be as satisfied with your hip replacement or your knee replacement as anyone else who doesn't have Paget's disease of bone. However, there is some controversy about the risk of complications in patients with Paget's disease of bone that undergo total hip replacements and total knee replacements compared with those that aren't affected by Paget's disease. And there is some evidence that's recent that there's a greater risk of complications, such as chest infections, clots, and some other respiratory complications or chest complications in patients with Paget's disease that undergo total hip replacements compared with the general population. And that's data from New York, from America and Harvard in a recent paper that assessed a large sample of patients with total hip replacements, both with Paget's disease and those without, and also from Di Martino in Italy, a group in Italy that examined the same. However, it's important to recognize that the overall incidence of these types of complications is extremely low. So even though there is potentially an increased risk from the evidence that's available at the moment, the overall risk is extremely low anyway. How long can you expect to have your hip replacement for? Well, the general evidence that we have at the moment about implant survival, or the duration that your implant will last, is currently quite aged anyway. So the evidence that we have is that 90 to 95% of hip replacements and knee replacements survive 10 years at least, and that's comparable with the general population. However, with more recent hip replacements and knee replacements, potentially over the last 5 to 10 years, it's much more likely that these implants will last anywhere between 15 and 20 years. And there's recent evidence in the general population to suggest that although there hasn't been any assessment of patients with Paget's disease as a separate cohort. So just to summarize, orthopedic surgery still has an important role in Paget's disease of bone, despite the improvements that we've seen in medical management. The most common surgical treatments for Paget's disease include total joint replacements, and those are predominantly total hip and total knee replacement, osteotomies, and fracture fixation. And the outcomes of total joint replacements in Paget's disease of bone are highly successful and comparable with that of the general population, but there is some evidence that there may be an increased risk of some complications, but the overall evidence for this is very limited at the moment, and there certainly needs to be more done to assess this in further detail and in much larger groups. However, if there's careful preoperative planning with the metabolic bone team and with our rheumatologist colleagues, then we can make sure we minimize any additional risk of these complications and make sure that we have the best possible outcome from any operation that you have. Sometimes, obviously, there are more complex joint replacements that are required, although this is rare, and they may require different implants or additional procedures such as osteotomies. Patients with Paget's disease bone can expect to have equal survivorship as the general population and equal satisfaction as the general population, and their implants are likely to last exactly the same duration as the general population. And patients who have broken bones can be fixed with predominantly plates and screws, or more commonly nails in modern times, and their outcomes following fixation and fracture healing are very comparable with the general population. However, as I said previously, there's much more research that's required to assess outcomes of fracture fixation and of joint replacement in the Paget's disease population, and comparing this with the general population. Thank you.